Thanks very much, Liam. Much less embarrassing than I feared. There's more. Oh, no. Okay, and thanks very much to the organising committee for inviting me to give this keynote speech. They know full well that the Administrative Data Research Centre in England is facing quite a lot of challenges compared with Scotland and Wales, who are really, moving forward in some areas much more than us. So it's really sweet of you to ask me to talk about the ADRC. So thanks very much. So let's just start with a bit of audience participation. How many, hands up, those of you that have made an application to the ADRN, the Administrative Data Research Network, or are currently involved in projects that are ADRN? Fantastic, right, so that's very good. We've only been taking external applications for the network since November 2014. So it's not been going for very long. So that's wonderful. Okay, so some people know about it. Right, let's get going with this. So what am I going to do in the next half hour? I'm going to talk a bit about how the ADRN works for those of you that haven't heard much about it. I'm then going to give you a bit of an overview about the work so far at the ADRC England, and particularly some of the lessons learned. Then need to use the F word and talk about options for going forward at the end. Okay, so the Administrative Data Research Network was funded by the Economic and Social Research Council, the ESRC, from the Business and Innovation Skills Department of the government, as part of the government's investment in big data. So it's a network of 4 centres in each of the 4 UK countries, plus an administrative data service, which is based at the University of Essex. Each of these centres are academic consortia, all of them are, and this whole lot, the academic side, received 34 million funding over 5 years to set up this, this service. There was additional money that went to the national statistical organisations partnering each of these centres in the 4 UK countries. So the vision was to benefit society and quality of life through intelligent social research. I really like that, because would you have unintelligent social research, maybe? And that would be through the use of for research of de-identified administrative data routinely collected by government departments and other agencies. And it's really about using data that's linked between government departments. It involves a sort of major research arm to develop methodologies in this area, but it also runs, this is unlike Farr, it runs a service to support external researchers, and it's built in an infrastructure to manage and minimise the risks associated with using that sort of data. So what is administrative data? Well, crudely, administrative data is about a physical unit. It's any data about a physical unit. So I think one way to divide that up is data about individuals, place and organisations. So here's some examples when we're talking about individuals. So we're all used to data that's about hospital records or people on the GP register, but here we're interested also in DVLA data of people that have driving licenses, taxpayer data, benefits, school results, offenders, and so on and so forth. And of course, the ONS census data or similar ones in Scotland are also part of that. So then the property place sorts of data that we're interested in, environment, local taxation based on households, house purchases data, smart meter data, and so on and so forth. And in fact, through Farr, many of us are used to using the organisation level data, although maybe we don't think about it in that way, but we're often using in our analyses hospital or GP practice as part of our multi-level analyses. But there's much more. So just a few examples of work that's going on in the ADRC for England. So there's one study run by Ben Anderson at Southampton looking at water meter data, linking water meter data to the household data and household characteristics in the ONS census data, for example. Paul Wilkinson at the London School of Hygiene is linking environment data on pollution indices in time and place with cardiovascular outcomes in hospital records. Bilal Nassim in the ADRC England is doing some of the metadata work at categorising schools according to type of school at a particular time, and characteristics such as number of children and so on, so that you can use that data then linking it into individual data on school results without having to know details of which school it is, because of course that all becomes quite disclosive. So those are some of the examples. The other work that's really important to this is to also link in studies such as cohort studies, and part of the ADRC England includes the closer collaboration, which involves a whole suite of the large cohort studies in the UK. So one of the ones that is being linked at the moment is the Millennium Cohort Study, linking that into education data, hospital data, the English Longitudinal Study of Ageing linked in now to HMRC data, so taxpayer data, that's Her Majesty's Revenue and Customs data, and hospital episode statistics. This is all really useful because it allows us to use a rich cohort data with details on the individuals to calibrate the sort of information, and there's a sort of quality check on the data we're seeing in the administrative data. So that's a very sort of important part of our work. So that's what administrative data is. So for the to use the ADRN projects must be non-commercial research. They usually involve linkage of data, as I said, between government departments or between studies and government departments or surveys. They must be feasible and viable, and I must admit I went back and looked up the distinction between feasible and viable, but there is a problem between saying what's possible, and lots of things are possible you could wish for, and what's viable, what's actually practicable in the real world, given government resources and what government departments are willing to do. Must be ethical and have clear potential public benefit. They need to use the ADRN safe settings. So not that you could just do it in your own institute, and should not duplicate normal government work. They need to publish. Okay, and that's our website there. Then once you've made an application, and if it's been approved by the ADRN Approvals Board, then a number of, there's a certain amount of support that comes with that. The ADRN doesn't take away the pain of filling in all those forms for the different government departments, for the ethics committees, for the confidentiality advisory group, and so on and so forth. You have to do all of that, and it's a huge amount of work because it's not just to one government department usually you're wanting to link between, so it's all more than doubled. And the ADRN application process adds further forms as well, so it doesn't take away that pain. And of course, when you've got a big problem that we find, that when you're sort of wanting to change certain details, you've got to change them on all these forms. So that's a bit of a nightmare. But once you've got through all of that, then ADS should be negotiating data access with data providers for you. Exactly how that will work out is we're still working through that. Projects, now this is of interest, projects will have the costs of linkage met by the ADRN. So there is a budget there to support the costs of linkage. Data will be stored in the ADRC data safe setting. Depending on which centre, if you're using England data, then it will be in the England safe settings. And researchers will be trained and accredited to use the ADRN facilities. So there's quite a lot of training and capacity building that's part of it. So what happens to the data? So imagine you've got data coming from 2 different departments that would be transferred from the data providers to a trusted linkage partner. Now this depends on who this is, depends on the ADRC. So if you're in Wales, that will be SAIL. If you're in Scotland, that will be IDRIS. But if you're in England, then it should be the Office of National Statistics. That's our partner. That's also should be serving as the trusted third party. So I'm already stumbling on one of the particular challenges for England, because we're in a situation where there's actually very many potential trusted third parties in England, and there's no tradition of different government departments using a single trusted third party. They've grown up separately, ONS doing things very differently from HMRC, from HSC, IC, and so on and so forth. So in practice, what we're doing is going to the relevant trusted third parties within the government departments. So if I want to link Department for Education data with HSCIC data, that will either be linked in HSCIC or in the Department for Education. It's unrealistic to expect that data to go to ONS. That's not happening. So that's a slight difference with England. So the linked de-identified data will then be released to an ADRC safe setting. So we all have safe settings at different levels of depending on the sensitivity of the data. And then all analyses will be done within the safe setting. Outputs from the analyses will be vetted and approved by ADRC data scientists. So they're all trained in statistical disclosure controls. And at the end of the project, the data will be destroyed, but the documentation and syntax will be retained. So this is, I think, something that needs to be sort of reviewed with experience, because what we're seeing, I think we're all seeing, is that these processes are extremely long-winded, and in fact the processes of cleaning up, of linkage and cleaning up the data is also extremely long-winded. So I think we need to sort of review the sort of efficiencies of this step. And so what have we got so far? So across the ADRN, we've got about 50 projects in application or started. They're mostly from researchers in the ADRCs who are testing these processes and feasibility. So what about the work so far? So just a bit about ADRC. So we're a consortium of academic institutions. We're led by the University of Southampton. And that's the director's Peter Smith. Then there's a Bloomsbury group that I'm part of. So that includes University College London, the Farr Institute, Institute of Child Health, Institute of Education, Institute of Crime Science, and Geography. And the great thing about Geography is they also lead the Consumer Data Research Centre, which is another ESRC investment. So somewhere ahead, we'll be really interested in looking at potential for linkage between retail data, which is what they're capturing, and administrative data. The London School of Hygiene, the lead there is Paul Wilkinson, who's particularly interested in environmental health, and the Institute of Fiscal Studies, and you can imagine they're interested in financial data. So these are the funding structures. So work so far, our safe settings, our main one is in Southampton. That's impact level IL3, but we can access that via a safe room that's almost ready to go, probably next week, that's based at Farr, so we've got a room there. ONS have a safe haven for more sensitive data that we can use, and UCL does as well. We've done a lot of training and capacity building, so in the 16 months since we've been active, we've run 15 courses. We run monthly seminars in collaboration with the Farr Institute at the Farr Institute, and there's 6 PhD students who are coming to the end of their first year. But I want to talk more about the research and the lessons learned, and I want to sort of bring the lessons together under the headings of, sort of technical challenges, decision making, and how we realise the societal benefits, that part of the vision right at the start. So one of the lessons learned in terms of technical challenges is that linkage error matters, especially for subgroups, and it's largely unevaluated. So you as the researchers, really can't know very much about the extent of linkage error because no one's going to tell you because it's really not been looked at. So one of our projects, which has actually started off as being ESRC funded and is as a separate project, is now part of the ADRC England, is something that Katie Harron, who's here, and Gareth Hager-Johnson are leading. And it's about evaluating linkage error in HES. Here we have to collaborate with the HSCIC, and we've been very fortunate to have a really good working relationship with them, but it means a researcher being in HSCIC. And what Gareth was, one of the pieces of work that's just come out in July, was Gareth was evaluating the HES algorithm. So even before you worry about linkage error between data sets, you should be worrying about linkage between individuals within the same data set. So Gareth was looking at that, applying the HES algorithm to actually an external data set, the Paediatric Intensive Care National Audit data set, where we had a reference ID as the reference standard to compare with, to look at the force match rate using exactly the same identifiers as HES use. And what we saw there was that there's a really low force match rate, which is not surprising. That's the way the algorithm's set up. But what was not known before is how high the mismatch rate is. So that's people that should be linked that aren't being linked in. And what Gareth's work showed was, does it matter? Well, yes, it does actually matter. You underestimate readmission rates by 3.8%, but those rates are much worse for certain groups, in this case, young, black, Asian, or other ethnic groups. And when you're looking at performance monitoring, that might be comparing readmission rates between trusts, then this sort of error will matter. So he's now going on to, he's in the midst of working directly with the HES data set, compared with the Personal Demographics Service, PDS, to further quantify the error, more force match, mismatch rates. But to go further, to look at evaluating the use of match probabilities rather than just match weights for probabilistic linkage, and always looking at the impact on results, because that's what matters. So another example is with the education data. So here we're working on comparing linkage error for cohorts. So we don't have force match or mismatch rates. All we get reported is match rates, which is the total number linked out of the total that could possibly be linked. And that's coming out at around 86 to 88% for one cohort and 2 clinical data sets that we've linked within ADRC England. And I think this is very similar to ours pack, if John McLeod is here as well. So we're comparing the characteristics. This is Efrosini Satakis, and ADRC is doing this, comparing characteristics of linked and unlinked children in cohorts. Louise McGrath-Lone, I think she's here, is looking at linking looked after children data to education data, and she spoke earlier this week about some of the problems for those children that go into care before school age and leave care before school age. There's particular challenges there about linking them to the education data, so she'll be looking into that. And the other bit of work that's relevant to the education sector is we are working with HSCIC and the Department for Education, both very keen to see HES data, so hospital episode statistics linked to education data. And there we'll be using names, date of birth and address histories. I like it because PDS say date of birth histories as well, because it does happen, via the personal demographic service. So we're still in the application stage and moving through the sort of legal issues there. The last one, really interesting project, is at the Institute of Fiscal Studies, this Lorraine Dearden's group. They're linking, so they've got the data, they're doing the analyses at the moment. So linking student loan data to earnings data from the HMRC. So that's had a very sort of long gestation, but that's going, and the results should be out in a few months. Okay, so that's education. The other group we're working with is the Ministry of Justice, and here we're going to again have somebody in-house looking at evaluating linkage error with them. I'm very glad to say we have got one researcher who passed all their vetting procedures, so that's great. What the MOJ have been doing, I mean, they've been linking between about 12 data sets over the last couple of years. And so, for instance, they've achieved an 81% match rate linking offender data to earnings and benefits data using a 24-step deterministic algorithm. So they're particularly keen to look at what happens after offenders, in this study, offenders leave prison. And what proportion are claiming benefits, what proportion are actually in employment. So it's very difficult to interpret this 81% matched rate, because are 19% just not in either of those, or is this missed matches? So it's quite important for sort of monitoring outcomes for the criminal justice system. One of the interesting things about the MOJ, for some of you data providers here, is that they use a principle of proportionate flow, proportionate risk for flow of identifiers between government departments. So if you've got a small data set in MOJ that's going to link with a big data set in DWP, then they'll send the identifiers that way. But if it's a small data set in DWP, certain benefits claimants, say, going to the MOJ data, a big data set, it will go the other way. I mean, many of you will have experienced the issues of government departments saying, no, we never let identifiers go out. And we've got to crack that if we're going to be doing linkage across departments. Lastly, we're developing standards for information relating to the linkage process. Working with ONS, they've seconded a researcher to work with us on this, and we're holding workshops with other data providers, and we're going to be doing case studies on what's feasible. The issue is, I mean, some of you would have gone to the Record meeting earlier in the week, so the issue is we as researchers want to be able to describe what's being done to the data that we use, but if you never get that information from data providers about all the steps in the process, then you're not going to be able to say very much about it. So we're looking at that end of what is it reasonable and feasible for data providers to be telling you about what they're doing with data. So that's a one-year project. Okay, so the second sort of set of lessons learned are about decision-making. I think the sort of bottom line here is that we're finding decisions are rule-based, and there's limited consideration of societal benefits and often a focus on the organisational perspectives. So examples are, many will be familiar with this, that the rules differ according to who funds you as a researcher or where your employment contract is. So if you're employed by Public Health England, it's different to whether you're employed by UCL. It's different if you're funded by the Department of Health compared with funded by the MRC. It takes you into different channels for example, the most important bit of health data, which is mortality, held by ONS. If you're Department of Health funded, you get exemption under Secretary of State because you're working on behalf of the Secretary of State. Otherwise, you have to go through another process, which is the approved researcher status application. And also, there's complete differences as to whether the same analysis of the same data for the same purposes is called research or audit or evaluation, or it's part of the service. The risks are the same, but the hoops we have to go through and sometimes the costs are different. So that's really anomalous, and it has no relationship to decision making that's based on balancing societal benefits with the risks. So I think it really needs addressing. Many government departments appear to be bound by legal frameworks related to their department, but it only appears to, because these things can change. So, for instance, the Department of Education, over the years I've been working with them, one application took 18 months, and then they started to be to interpret much more broadly the requirement to be relevant to Department for Education work, and our last one took only a month or two. So, as you know, with health, it's on their website that the study purpose for getting health data from HSCIC must support the provision of health and social care and the promotion of health. Now, that has been interpreted as needing to demonstrate benefit to NHS systems, and I know that some people are working on developing approaches. MRC is working on this that related to demonstrating pathways to impact. But I think there's also an issue as to, does the interpretation need to be so narrowly defined, when actually when you think about the societal benefit of using health data, we all want to know whether healthcare is getting people back to work after they've had cancer, whether the healthcare for children is improving their education outcomes, and so on. And quite frankly, what this clause does for us is that we write our applications differently. So the linkage of HES to MPD application, we wrote it so that it is, the key outcome is impact on emergency admissions. And of course we're interested in, this is about chronic conditions in children, of course we're interested in the impact of healthcare on the school achievement, but we have to write it so it's really ticking that box. This needs to be changed. And then thirdly, the HMRC is viewed as being, the most difficult government agency to get data out of, and they only allow data for HMRC purposes. But hang on, if you look on the HMRC website, there's actually 51 legal gateways listed there, including the student loans data. And in fact, there's a 52nd added in July that was from which now allows linkage between higher education data and national pupil data to HMRC. You wouldn't know about that because actually it was slipped in under the Small Businesses Bill. So what it shows you is that there's a complete myriad. Well, it shows you, first of all, that rules can change and legislation can change in that instance, but it's so complicated. And it's beyond the capability of people filling in research applications and often the staff to know all about this. So it's not just us saying that. So there was the Law Commission report in 2014 that looked at data sharing between public bodies. It's a bit of a weighty report, 188 pages. But it came to the conclusion that there are both unnecessary obstacles to useful and legitimate data sharing and a lack of clear and principled approach to proper safeguards for privacy. There's also a lack of transparency. Some of the obstacles stem from the law and some from other sources such as institutional attitudes and incentives or disincentives to share. And they also commented that, very often staff didn't know all the rules. And so in effect, although it's supposed to be, decision making is supposed to be rules-based, it ends up being discretionary because of the issue about knowing about all those rules or the issues about interpretation. The problem is that those discretionary judgments are not transparent, they're not written down, and they do not address the agenda of balancing societal benefits with risks. So they do not address what Graham Laurie was saying on Wednesday, which is our social license from citizens to use data. They called for a full law reform project, which perhaps too focused on the legal aspects rather than the whole sort of governance structures. But it did trigger the open policy process led by the Cabinet Office that started up in 2014, which was really to encourage analysts in different government departments to work together. Sadly, HSCIC actually exempted themselves explicitly from that process. That's what we're seeing in the Cabinet Office papers. But I see in their 5-year forward strategy recently, they did say there's a growing interest in the open data process. So maybe they'll be coming back to it. And that was last year in the middle of the care.data debacle. Okay, so the third set of lessons learned is about realising societal benefits. So here I think what's really striking is the lack of systems to integrate evidence from using administrative data into improvements in public services. So the means by which we address those societal benefits and the social license are not there. What we need to face as researchers is that the data provider is mainly interested in using these data to keep the service running and paid for. So HSCIC has to keep the data flowing so that NHS England can pay the 29 billion a year commissioning budget, or the 90 billion a year for all of the services. They've got to keep that show on the road. And we are small beer. We're actually an irritation. And we could leave ourselves as just an irritation on the edge of these things, or we could be a greater part of it. So Liam's shown me the thing. So I'll just run very quickly through this, which is to say that I think we need to bring that research, us as researchers, into the wider services. And that means bringing together research, evaluation, and service uses of administrative data across government departments. So, and making sure that decision-making about access and cost of data always consider the societal benefits versus the risks. Just deal with costs there. And we are seeing a whole plethora of government bodies and data owners charging other public bodies, public services, and publicly funded researchers for using this administrative data that comes from the citizens. So, I mean, I think the biggest example of that we will have experienced is the very high costs, 6-figure costs per year for using primary care data. Now, that really undermines the arguments for us realising using this data for the benefit of society if there's these massive cost barriers for using that data, so that the GPs putting that data in, if they're academic and they're researchers, can't easily access it unless they have a very large programme grant. But it's not just the primary care data. This is happening all over. So that's a big problem. But the other problem we need to consider here is that our worries about privacy, I think, are a tiny part of the problem. The big problem in using administrative data that threatens our use, as much as it threatens the service, as much as it threatens, service evaluation, is making wrong decisions about the way data are used, and making wrong decisions that shift the benefits-harm ratio towards harms. So legally, so care.data was an example of decisions that were legal but were really wrong. And if we were to share data very widely, identifiable data, with many, many authorities, we now have health split into the NHS and to local authorities, this could be really alarming. And that's a much bigger threat to us than I think the privacy, us worrying about how we control privacy access, confidentiality in research. And we need to be part of that debate. We can't just sit outside of it. And of course, we need to be helping getting the evidence from data use to keep services effective and running efficiently. So I need to mention the F word very quickly at the end, which is funding. It's worth standing back and just seeing where the money goes. So there's about 10.6 billion, sorry, this is 2013 data, that's the most complete list I could get. 10.6 billion spent by the government on R&D. And that's 0.6% of GDP. Nearly a third goes to research councils. MRC and EPSRC each get about a quarter of that. And then there's only a quarter that goes to the civil departments. But these are the people that are the data providers. So let's look at that more closely. The Ministry of Defence gets a massive amount. So here's the civil departments. And the big ones are biz and health. But the people that we want to, so health, great, they get loads of money, and that's the data Farr is really interested in. But from ADRC, we're really interested in working with Ministry of Justice, look at that, 7 million a year, their whole R&D budget. Department for Education, 14 million. DWP, one of the biggest spending departments, 20 million a year. Department for Environment and Climate Change, a bit more. So they are hamstrung to help in this endeavour, to use administrative data more effectively to improve services. And unless we change this funding structure, we are not going to be able to address that societal balance. Health, actually, most of this goes to the NIHR, the National Institute for Health Research. It's apparently in 2015, I think their budget was $1 billion a year. But 300 million of that goes on infrastructure, actually. They face the same problem as us with data providers, not having the capacity to make research work. NIHR looked at the NHS and said, well, we can't get trials into trusts. They're just not research ready. We're an irritation to their general work, which is to get patients in, patients out. And they've put in a lot of infrastructure funding, now about 300 million a year, plus for the local clinical research networks, to make trusts research ready, so that research could be run alongside their day business, and then be integrated, through guidelines and various other structures into practice. So maybe there's a model there of how we should think about funding government departments across the piece to start making better use of data for all the purposes. Okay, so on to the options. This is my last slide. So I think, we have an option. We could carry on and collaborate with data providers as we are and keep going. It will be a slow burn. Or we could scale up and realise the societal benefits and start to deliver our social contract. This is ambitious, but I think this is where we need to go. So we need to be using evidence from analyses of administrative data for societal benefit, including contributing to learning public services. Decision-making should weigh societal benefits against risks for any use of administrative data, and that will just stop mad decisions like care.data if the risks are properly weighed against the benefits. Infrastructure funding, so this is the NIHR model, really is needed to support effective use of administrative data across government departments and to encourage them to work together. And we need to make administrative data research just part of the service. Thank you very much, and thanks to my team. Thank you.